بسم الله الرحمن الرحيم. يعني few بس regulatory remarks كده، هم 10 questions. 5 first questions على guidelines بتاع Egyptian guidelines on dyslipidemia 2021 و5 question على European guidelines 2018 بتاعت الهايبرتنشن. 10 اسئله في ربع ساعه، فتقريبا احنا هندي تشانس دقيقه ونص لكل سؤال. It goes without saying طبعا ان احنا لما هنبدا البرزنتيشن اللي هيبقى فيها الاجابات بالايفيدنس بتاعتها لازم هنكون اوريدي احنا عملنا كولكشن للورق، يعني احنا خلاص فتحنا البرزنتيشن وهنبتدي نعرض الاجابات، فاللي هيبقى لسه محتفظ بورقته قطعا احنا مش هناخدها منه بعد كده. فاحنا ان شاء الله هنبدا يعني under the supervision of our dear chairperson اللي متواجد منهم دلوقتي استاذ الفاضل الاستاذ الدكتور احمد الغليظ.
طيب نبتدي ان شاء الله، والاسلام هيبتدي الاول. يلا اتفضل يا اسلام.
بسم الله الرحمن الرحيم. احنا في 5 questions على الديسليبيديميا and the answer should be according to the Egyptian guidelines، بس عشان حضراتكم تبقوا ايه برضه النقطة دي عارفينها قبل ما تبدأوا تجاوبوا. The first question: the following are factors associated with increased risk of statin intolerance except A. advanced age, B. pre-existing liver disease, C. pre-existing kidney disease, D. hyperthyroidism, and lastly E. high dose statin therapy. All of them are right except one. طيب هقولها تاني، هقراها تاني لحضراتكم. The following are factors associated with increased risk of statin intolerance except A. advanced age, B. pre-existing liver disease, C. pre-existing kidney disease, D. hyperthyroidism, and E. high dose statin therapy. كبروا لنا كمان الشاشة. اوكي؟ We should move on to the next question. Target LDL cholesterol is. This is according to the Egyptian.
كبر الشاشة أحسن. صورة إسلام إحنا شايفينه هو جميل طبعا، بس
كده واضحة صح؟ الشاشة واضحة أعتقد. وبعدين أنا هقرأ طبعا الكويشن وقدامكم في حدود دقيقة للإجابة. هتبقى نفس السلايد على السكرين. According to the Egyptian guidelines, target LDL cholesterol is A. 190 mg per deciliter in low risk patients, B. 130 mg per deciliter in intermediate risk patients, which means 2 or more risk factors, C. less than 110 mg per deciliter in high risk patients, which means 3 or more risk factors for diabetes mellitus or CKD or chronic stable atherosclerotic cardiovascular disease. And lastly D. less than 70 mg per deciliter in very high risk patients with acute coronary syndrome or stroke or acute atherosclerotic vascular event despite statin treatment. Only one answer is correct. We move on to question 3. The following are correct in dyslipidemia with diabetes mellitus except A. statins are recommended for all patients with diabetes mellitus. B. no definite evidence on whether statin therapy is beneficial for primary prevention in diabetic patients aged from 20 to 39 years old. C. LDL cholesterol level should be reduced by 50% or more from baseline value using statin therapy. D. ezetimibe 10 milligram per day should be added if the target level is not achieved with the most tolerable dose of high-intensity statin therapy. E, no clinical benefit from triglyceride-lowering therapy as an add-on to statin in hypertriglyceridemia. So again, all of them are correct except one. We need the exception. امتحان الزمالة دلوقتي. Question 4. The following are correct in dyslipidemia with acute coronary syndrome except A. Patients older than 75 years shouldn't receive high intensity statin. B. If LDL cholesterol target level is not achieved with the most tolerable dose of high intensity statin therapy, ezetimibe 10 mg per deciliter should be added. C. If the LDL cholesterol target level is not achieved after 4 to 6 weeks of statin, ezetimibe combination therapy or PCSK9 inhibitor should be considered. D. In patients with recurrent attacks of acute coronary syndrome, despite reaching the LDL cholesterol target, maximize the statin and adding ezetimibe is recommended. The last question with regard to dyslipidemia guidelines. The following are correct in dyslipidemia with CKD except patient with CKD are at high risk of atherosclerotic cardiovascular disease. B. Medications that are excreted via hepatic metabolism like atorvastatin, pitavastatin, and ezetimibe are preferred. C. Patients on dialysis shouldn't receive statin therapy at all. And D. Patients with non-dialysis dependent CKD and elevated LDL cholesterol level should receive statin therapy.
تمام كده. ده النص الاولاني من الكويز. دكتور محمد عبد الشافي هيكمل النص الثاني.
Again طبعا question
شكراً
ده
يا
is
إسلام.
a single false statement.
محمد بعد اذنك دي لها جوائز ان شاء الله. جوائز بكره ان شاء الله في الراب اب سيشن الثلاثه الاوائل.
هو
يعني
الريمايندر ده طبعا مهم
ان
ان احنا ان شاء الله في الراب اب سيشن في نهايه المؤتمر الورق ده هيتاخد وفي كنترول معمول مني ودكتور اسلام. احنا الكنترول اللي هنصحح وفي الاخر هنرتب الناس وان شاء الله هيبقى في جوائز للقصه ديت باذن الله تعالى. افندم البارتيسيبانتس يعني كده حضرتك واثنين بس اللي هيشتركوا.
الاقل من 40 سنه انا منهم ان شاء الله. زودي شويه.
طيب بالنسبه للهايبرتنشن all of the following are routine investigations in patients with newly diagnosed hypertension except يعني
كبر
كلهم
الشاشة.
صح except a single answer that is not routine في ال primary evaluation in hypertension. Resting 12 lead ECG, a transthoracic echocardiogram, fasting blood sugar, lipid profile, urine albumin creatinine ratio. A single wrong answer.
شايف اللي بيغش ورا ده انا شايفه كويس. ها
Okay. Let's move on. Question 7. Monotherapy is accepted in the following scenarios except according to the European Society of Cardiology, starting even with grade 1 hypertension with single pill combination therapy is the rule, but there is still room for monotherapy in some populations in some scenarios. So all of these scenarios are accepted scenarios to start monotherapy for starting treatment for hypertension, except a single one. Blood pressure 145 over 95 millimeter mercury, ده ال diagnostic blood pressure بتاع العيان. Frail patients with grade 1 hypertension. A 65-year-old male with stage 1 hypertension. High normal blood pressure with established cardiovascular disease. Monotherapy actually is appropriate in all the previous scenarios. They are all correct وما فيش exceptions ولا حاجة. Okay, let's move on. المفروض بقى نغش ده من محاضرة بروفيسور بول ويلسون طبعا. Cardiovascular risk assessment in patients with hypertension using the SCORE system is recommended for which of the following. Patients with moderate renal disease, يعني هي القاعدة إن في cardiovascular risk assessment to stratify our hypertensive patient as being high risk or very high risk to start treatment, especially في low blood pressure أو blood pressure stage 1. فالسكور using السكور system اللي هو الكالكوليتر أو السكورينج system بتاع اليوروبيان is appropriate or recommended في سيناريو من السيناريوهات اللي جاية. Patients with moderate renal disease, patients with left ventricular hypertrophy, patients with long-standing type 2 diabetes mellitus, patients with established cardiovascular disease, or score system is not indicated, مش appropriate وملوش لازمة in any of the above patients population. Risk stratification is universally important. احنا بنتكلم على score system as a tool. Is it which of the following is still appropriate to use it and calculate using the score system? Okay. Question 9. Which of the following statements regarding hypertension treatment is true according to the European Society of Cardiology 2018? We aim to control blood pressure in grade 2 hypertension in 3 months. يعني ده الايفالويشن اللي بناء عليه بنقيم العيان controlled ولا لا. In patients with grade 3 or severe hypertension, we aim to control blood pressure in 2 weeks. In patients with grade 1 hypertension, initiate drug treatment after 1 month of failure of lifestyle advice. Start life advice alone in all patients with high normal blood pressure. Yani this is the only tool in patients with high normal blood pressure. All of the above are not true. يبقى الأصل إن ال statements كلها incorrect or false statement. We have a single correct or true statement. أو إن إحنا ننقي E اللي هو ما فيش ولا statement is true كلهم false. To remind you, there is a single correct statement. Okay, last question. You can start hypertension treatment with beta blockers in all of the following patients, يعني except يعني it's appropriate ان البيتا بلوكر يبقى your starting treatment for your patient في سيناريوهات كل السيناريوهات اللي جايه صح ما عدا single سيناريو اللي مش هينفع نعمل فيه كده. Patients with angina, patients with heart failure, patients with atrial fibrillation, young female patients planning pregnancy. E. It is appropriate to start hypertension treatment with beta blockers in all of the above patients. again الستم بتاع الكويشن معناه ان beta blockers is appropriate in all of these scenarios except a single scenario اللي احنا هنstick to the guidelines we start with the other first line treatment strategies or ان احنا we can choose E ان احنا we approve that all the 4 scenarios is appropriate to start beta blockers as an antihypertensive treatment. Okay, I'd like to thank you very much for your participation.
شكرا دكتور.
احنا يعني within 1 minute هنحاول نكولابوريت سوا ان احنا نجمع الورق من حضراتكم وبعد كده هنبتدي طبعا اللي هي هنجاوب على الاسئله سريعا ب a single slide for each question to elaborate the answer. Thank you very much.
شكرا دكتور محمد على الاسئله القيمه دي صراحه ان شاء الله الاجابات تبقى مفيده للبانل كله. حد هيلم الورق يا دكتور؟ ماشي.
احنا بنستأذن حضراتكم بس ورق الأسئلة إن شاء الله كله هيتلم قبل احنا هنقول الكوركت انسرز دلوقتي بس يعني لو في ورق هيبقى مع حد مش هنعرف ناخده بعد الكوركت انسرز فنستأذنكم بس كل اللي معاه الانسر شيت يسلمه.
في حد معاه ورق تاني؟
Okay, for the sake of time, we will start answering the question. So please, if you still have your paper, يعني we might not take it at this point of time.
خلاص كده خلاص كله سلم الورق بتاعه.
Thank you very much. اتفضل دكتور اسلام.
دكتور اسلام هو الهيئة. اسلام ده بقى وحضرتك جبت الاسئله مفضل.
اللي هي البرزنتيشن الثانيه اللي في نفس السيشن.
اتفضل دكتور اسلام.
نبدأ نجاوب بقى. اوكي. The following طبعا احنا هنجاوب على طول بقى ده كان السؤال الاولاني. The following are factors associated with increased risk of statin intolerance except hyperthyroidism. اوكي except ده wrong. كبر معلش سكرين الاسئله. بدل صورته تمام كده. The following are factors associated with increased risk of statin intolerance except the correct answer is letter D hyperthyroidism. اوكي هي المفروض انه الهايبوثايرويدزم. Thyroid disorder associated with increased risk of statin intolerance is untreated hypothyroidism مش hyperthyroidism. The target LDL cholesterol is Letter D is the correct answer. Less than 70 milligram per deciliter in very high risk patients with acute coronary syndrome or stroke or acute atherosclerotic vascular event despite statin therapy. ودي ال cut off values بتاع ال Egyptian Association of Hypertension guidelines of dyslipidemia. Question 3. The following are correct in dyslipidemia with diabetes mellitus except no clinical benefit from triglyceride lowering therapy as an add-on to statin in hypertriglyceridemia. دي طبعا correct answer يعني مش غلط. يعني انا قصدي ان هو الستيتمنت نفسها. In dyslipidemia management in patients with diabetes mellitus, there is a possible clinical benefit from triglycerides lowering therapy as an add-on to statin in hypertriglyceridemia. ساعة الغداء طبعا محدش بيعرف حد. ما ده برين ستورمنج بقى قبل الجلوكوز. The following are correct in dyslipidemia with acute coronary syndrome except patients older than 70-year-old shouldn't receive high intensity statin. Patients older than 70-year-old should receive high intensity statin to reach the LDL level target level, but after consideration of patient lifespan, possibility of adverse effects and drug-drug interaction. The following are correct in dyslipidemia with CKD except patients on dialysis shouldn't receive statin therapy at all. هي المشكلة في at all كلمة at all. Patients on dialysis are not advised to receive statin therapy except those who are already on statin who should continue therapy.
Thank you, Islam.
To move on عشان hypertension. Question الأولاني, all of the following are routine investigation in patients with newly diagnosed hypertension except the correct answer is letter B. Echocardiography is not indicated as a routine investigation في uncomplicated patients newly diagnosed with hypertension. ودي list of routine laboratory tests included all of the other subjects including a resting ECG and does not include resting echocardiography. Monotherapy is accepted in the following scenarios except هو a 65-year-old patient with stage 1 hypertension. This is a patient who is still going to receive single pill combination therapy. ودي according للجايدلاينز زي ما احنا شايفين ان احنا ال consider monotherapy in low risk grade 1 hypertension systolic blood pressure اقل من 150 frail patient. الديفينيشن بتاع الاولد هنا اللي هيريسيف برضه monotherapy اللي هو above 80 years of age مش 65 years of age. وطبعا الناس اللي هم عندهم high normal blood pressure بس عندهم high cardiovascular risk وهيريسيف anti hypertensive treatment برضه they will receive monotherapy and it's totally accepted in them. Cardiovascular risk assessment in patients with hypertension using score system is recommended for which of the following? Actually, score system is not indicated in any of the above patients population لأن ال patients دول كلهم according to the guidelines are inherently at high risk or very high risk والسكور ريسك كالكوليتر بيستخدم في الناس اللي ما عندهمش الهاي ريسك فيتشرز دول. This includes, according to the statement in European Society of Cardiology, that using the score system is recommended for hypertensive patients who are not already at high or very high risk due to established cardiovascular disease, renal disease, diabetes, markedly elevated single risk factor, or hypertensive left ventricular hypertrophy. Which of the following statements regarding hypertension treatment is true? The only the proper and true statement is that we aim to control blood pressure in grade 2 hypertension in 3 months. دي letter A ودي الستيتمنت الوحيده اللي صح. بقيه الستيتمنت عشان نفندها الهاي نورمال بلاد بريشر مش كلهم هياخدوا لايف ستايل معظمهم اكيد بس we consider drug treatment in patient at very high cardiovascular risk. We start drug treatment for grade 1 hypertension after failure of lifestyle advice for 3 to 6 months مش 1 month ولا حاجة. وأخيرا grade 3 hypertension زيه زي grade 2 hypertension we aim at blood pressure control within 3 months not within 2 weeks. أخيرا you can start hypertension treatment with beta blockers in all of the following patients except actually it is appropriate to start hypertension treatment in all of the above patients ودي منصوص عليها في نفس السلايد بتاعه الهايبرتنسيف population في البوكس اللي تحت. Consider beta blockers at any treatment step when there is a specific indication for their use. والindications ديت is heart failure, angina, post-MI, atrial fibrillation, younger women with planning or already being pregnant. And thank you very much.
ثانك يو محمد. يعني جريت ايفورت انت واسلام الحقيقه وان شاء الله كده بون شانس بون ابيتي.